Listen, I wish we'd have met under better circumstances. I just sent two kids off to school for the fall. As a parent, a little petrified, right? A little worried about
Right,
what's
right.
happening. It's very disconcerting to see experts in the medical community leaving positions that, frankly, they were working in under duress and are now leaving because of the threats to the American public healthcare system, almost as a form of protest. As someone who is in this industry, talk to us about some of the things that you're seeing that give you the most alarm.
Yeah, I think what gives me the most alarm is the politicization of the CDC, right, of public health in general. And we saw this coming. I mean, our organization, the Committee to Protect Healthcare, circulated a letter of 22,000 doctors back in December, January, when they were considering RFK Jr. for this position and kind of saw the writing on the wall. You know, this guy comes in with preconceived notions about vaccines, lots of conspiracy theories about things like still HIV and AIDS and SSRIs causing mass shootings, and it's just the list goes on. And so to have someone like that who really was brought in by Trump because of a voting block of Maha, you kind of saw that something like this could come to pass, and now we're seeing it come full circle. And these folks who no doubt people who want to help people, right? People don't go into public health for glory, for fame, for notoriety. They go into it because they want to be the silent observers of health and kind of the backbone of what we all do on the front lines. I don't practice public health. I certainly study it, but I depend upon those folks who are apolitical, who aren't seeking the limelight, who have really no preconceived notions about any of this. They're just following what the data shows them and then giving recommendations to us and to the public. The fact that that is breaking down, I really should give moms like you and docs like me and really everybody pause, because it does make us less safe.
You know, there was a former CDC leader who was quoted as saying that we should all be scared about the nation's health security. And I just had pediatrician appointments for my youngest the other day, and I was like, "Doc, should we be going to Canada for these vaccines? Like, let us
Yeah,
know. Like, should I take a trip to Mexico?" Which is a very privileged thing to even consider, right? There are
for
the
sure.
overwhelming majority of people in this country can't even have a conversation like that. And so I don't know where to look. I've now sort of defaulted to, if I see data that's coming from a .gov website, I now have this instant doubt. Like, and I want to search out,
Yeah.
what's Canada saying about this? What are other nations saying about this? Because I now get alerts from the World Health Organization directly. Because once we pulled that, I was like, well, this is cuckoo for Cocoa Puffs. And I need to know what's
Yeah.
actually happening. What are Americans supposed to do? We've got some very troubling things happening, which you just outlined for us. You, as an emergency room doctor, don't have access to the data that you need to be effective at your job. I don't feel like my hair is on fire enough for this, and it feels really hot. Like, my hair is definitely on fire.
It should be, and it isn't hyperbole. Now, even within our own country, we now have states stepping up. I think announced today in the New York Times as the Western States Alliance, California, Oregon, and Washington have said they're going to pool their collective public health resources and make recommendations and sort of hopefully, for the West Coast at least, for those states, be the source of information for doctors and individuals. If you live in a state that doesn't have a politicized system of public health, that should be all 50 states. And let's be right, there are red states out there who, they still have a public health apparatus that is operating in good faith. Hopefully, I live in Michigan. We have a Democratic governor, and most of the leadership in the state is Democratic. And unfortunately, this has fallen on party lines in a lot of ways, certainly nationally, and certainly with Trump and RFK and the CDC. And so I think people have to look to their states. I think, if you want to get, I think, very good information, this Western States Alliance probably is a good source. I think, going directly to the WHO, that's, definitely not a bad idea. It's just, this shouldn't have to be, right. We're now calling on Congress to use their oversight responsibility and bring RFK Jr. in. Senator Cassidy, who's a physician, he assured his fellow senators that RFK Jr. told him, we're not going to go after vaccines, we're not going to go after basic science and public health, and he lied to him. Of course he did. We knew he was lying to him, and maybe he knew that, maybe he didn't. Maybe it was a political calculation that superseded his oath as a doctor. But now we're seeing what's come to pass, and Cassidy has even said now the advisory committee on immunizations shouldn't meet in their next meeting because the agenda is chock full of politicized and sort of preconceived notions that Kennedy brought to the agency before he even got there, and they should take a pause and hopefully they exercise that oversight. We haven't seen it all that much in the rest of government. HHS seems like a really important place for the health of all of us, that they should do that.
When you mentioned the three states that are forming this alliance, California, Oregon, and I can't remember the third one, Washington.
Washington. Yep.
And when I first saw that, I was like, oh, phew, okay, sanity. But then I was reminded there's this book that I read from an author that I love. You may or may not be familiar. Her name is Octavia Butler. And she had written this book called Parable of the Sower, followed by Parable of the Talent. And it was written in the 90s, but it starts off in the year 2024 with an American presidential candidate whose name is Donald Connor. And his
Oh
slogan is
Lord.
Make America Great Again, right? It's super weird. It's super weird. But
Wow.
in the background of the text of the book, she's talking about how there has been such a devolution of the nationhood concepts in America. So each state is like its own individual country. And so like this Western State Alliance, I was like, oh great. But then I was like, oh my God, this is happening. And it was this
Yeah.
idea that you're no longer going to have government providing for the public good, whether that's fire department services. Sure, you might have a fire burning your house down, but the fire department's only going to come if you have the money to pay them to come and get the water. Sure, you could call the police, but the police are only going to come if you have the money to pay them. And she really speaks to the concerns about privatization in some very powerful and allegorical ways. Some might say not an allegory, more of a prophecy. But I mention
Yeah.
it because this idea that red states were going to have one generally, and obviously there are going to be exceptions to this, but we're seeing if this is on party lines, red states having a particular approach to healthcare, blue states having a very different approach to healthcare. And since we're all in the same technical geographic boundaries called a nation, that to me feels like the ultimate in one public health betrayal, but it also feels like a recipe for disaster in so many ways because I don't think germs respect our boundary lines unless you know something I don't know.
No, I think you're spot on. And I mean, you said, as a nation, I mean, as a world, we found out with COVID, right? Germs don't respect the boundaries of nations. And
Right.
with air travel and sea travel, like germs don't respect the boundaries of oceans. I mean, they're going to go everywhere. We really, pulling out of WHO was a five-alarm fire. What RFK Jr. is doing and this mass exodus from the CDC because of people not wanting to be politicized and promoting, dangerous misinformation, that's a five-alarm fire. You're absolutely right. I mean, with avian flu, the CDC still puts on its website it's monitoring cases and the number of human cases. But we remember with COVID, Donald Trump said if we stop testing, we won't get as many cases because
That's right.
for him at least, it's about the vanity of how does this look, right? So if we start getting human to human transmission in the US with avian flu, that is a crisis in the making. They pulled the technology for mRNA vaccines that got us the COVID vaccine. Donald Trump's singular achievement in his first term that he should have been touting, and now he's backpedaling away from. So maybe they don't want to let us know if avian flu is spreading to human. If it happens in a state that doesn't happen to have an apparatus set up that is going to share real information, we may be blindsided when this thing really takes off. So, yeah, I think I guess we are stuck in the reality we are in for at least another year, for the oversight piece, another 3 years, I guess, until 28 when things can change. And so in that time, we do, I guess, have to lean on those states and those collections of states that are out there promoting, good science, good public health, and we'll just have to, kind of lean into that and accept that as our reality, as sad as that is.
So, one of the things that is most distressing to me about this is the fact that you, as a part of the medical profession, are in many ways, when it comes to public health knowledge, forced to fly blind in ways that feel like the antithesis of what an actual healthcare system is supposed to do. What should doctors and medical professionals be doing right now? Because we rely on you all to have access to this information. If you're not able to get access to this information in a way that is accurate, effective, and non politicized, what is it that medical professionals should be doing to sort of ameliorate some of the problems that this is going to create for all of us?
Yeah, I mean, we're going to have to look. Some of us have to look at the primary science, right? The primary data behind some of these vaccines, particularly the COVID vaccine, and who should get it, who maybe doesn't necessarily need it. We should be looking to this Western States Alliance, to other states, to those public health entities that are sharing good information. And if you happen to live in a place where that isn't happening, you're just going to have to go to a dot, a dot, whatever for California, Michigan, what have you, and get that information. And I think the other piece that people should be heartened to know, the vast majority of physicians in this country are generally just looking out for the person in the room in front of them and the community where they serve. I serve in a community that voted for Trump 70%, a rural West Michigan community. I care about these people. I believe the political leanings of the area have been led astray and have been duped. Some of those people are kind of realizing that now, but it's still my job, my duty, and my pleasure to serve these folks and to help take care of them. And so, I don't ask them who they voted for. No one asks their doctor who you vote for, and the vast majority of doctors just got into this thing to help people. So, when it comes to, say, the COVID vaccine and the FDA trying to limit its access, the access to certain people, doctors can still prescribe any medication off label. A lot of medications out there have gone through rigorous testing and a lot of research showing that they have other applications other than what the FDA approved them for. And many doctors routinely do prescribe, medications in that way, understanding we're taking on a bit of liability. But when the data and the science is solid and we're all doing it collectively, that risk is pretty minimal. So, I think people are really, doctors are going to have to get that info wherever they can, from other states perhaps, and then people are just going to have to trust that relationship they have with that physician that they've been seeing, or that nurse practitioner or PA, that provider, and trust that and lean into that for the foreseeable future.
So one of the scary things is, like, so as a black woman, I am very interested in who my doctor voted for, because have you seen
Okay.
racism in the
Yeah,
medical profession? Like, so
for
for
sure.
me, it's like it's
For sure.
huge. If I'm driving by a medical facility and I see like anything that looks too red of a hat, I'm
Mhm.
like, gotta go, making another appointment somewhere else. But you mentioned something along the lines that doctors are going to have to look at the source information. Now, is this similar? As an attorney, I can assure you that
Mhm.
if you need me to determine whether or not there is good case law on this particular topic, I can definitely do that. But if you need me to
Yeah.
go to the books to do it, it's going to take me a lot longer than if I can go on my electronic database and just pull up the little, the subscriptions that we have. Is it similar? Like, does it work like that in the medical profession? Like, do y'all have like your electronic databases, which are maybe largely dependent on this public health information, and then you've got this other, more antiquated form of research that doctors are
Yeah.
able to do? Does that exist in the medical community in the same way?
Yeah, I mean, in medicine, like, it's fast moving. I've been doing this for almost 30 years now, and
Yeah.
and things we did way back when in the 90s are absolutely 180-degree the opposite for certain diseases. And so as those things change,
Wow.
we're required to do continuing education every year. We all do that. We all have access to databases where, the recommendations are based on up-to-date studies. Um, I mean, I say that, but then as I think about it, the U.S. Preventive Services Task Force is one of those entities that makes a lot of the primary care recommendations for screenings and the like, and even that piece has been sort of upended. And so, boy, I know the more we talk, the more I'm kind of feeling a bit fatalistic
Are
about
we
the
talking
prospects.
ourselves into depression here, Doc? Is
Yeah, I
that what's
mean,
happening?
we all have to, right, come together, right, to have group therapy every once in a while. But yeah, it's a bit scary. And to your point about racism in healthcare, and that's another piece that this administration, particularly with their changes to student loans. I mean, historically marginalized and underrepresented folks in medicine have relied on student loans to get through medical school, and they've limited those options, limited the amounts. We're gonna see sort of changing, and the kind of people we have seen over the years. And I love, in advocacy, I'm seeing that doctors have gotten younger, more women, more people of color in the healthcare profession. That's another piece we have to talk about more, is how to maintain that, because so many people in our country don't feel represented by the people that they have access to for their healthcare. So I think
Right.
that's a really important piece as well.
I remember years ago, and I don't even know if it's still active, but before I realized that medical school and I were not going to go along, I remember there was this program. Sorry, so I often acknowledge
Yeah,
that I
yeah.
was supposed to be an OBGYN right now, but that did not happen.
Okay.
But there was this program that I remember Cuba had where they were providing free medical school training and education for people coming from the United States if they promised to then and pledged to then use their medical school training that they received in Cuba for free in economically disadvantaged areas in the United States. And I don't even know if that program is still functioning, but I hate to say it, but it feels like we are going to largely have to also consider relying on the generosity of other nations who don't want our American germs blowing into their airspace. Let's to be clear, because it feels like every one of the pathways that people from traditionally marginalized communities have used to get
Mm,
access to medical school education, that is being cut off with like cement being poured over the pathway. Like you will not be able to pass through here again. And all of this sort of, it feels like there's no way to say it, but intentional. It feels like and
yeah.
I used to use the word dismantling, Dr. Davison, but one of the listeners in the audience was like, dismantling implies that you intend to be able to put it back together. This feels more like a demolishing.
Right.
It
Oh, yeah.
I don't know how to feel about living in a nation where it feels like the people who are making decisions are intentionally demolishing systems like our public healthcare system. I'm struggling with what it means, what broader implications we can take from that in light of how everything else is playing out right now.
I mean, I hear you. They are taking a wrecking ball to so many, you hate to talk about norms because norms imply that the way things have been done have worked out for so many people, and they haven't, right? Income disparity is so high, healthcare costs are too high. We can't talk about rebuilding a system like it has been for, decades because that system has failed too many people. We need to look
Right.
forward, what and when they demolish all this and hopefully when sanity gets back in control and takes over, we will have a unique opportunity to rebuild some of these systems in a way that's more fair, more just, and really helps more people. It's sort of the it's not an escape, but it's the path that I've taken and so many have taken, and we have like 36,000 docs in the Committee to Protect Healthcare that are advocating for a better system of healthcare. But we're doing that through now into next year political advocacy.